Hi, my name is Megan Gomez. I want to start off this video by showing off the two binders that I made, chiropractic research binder and my chiropractic management binder in all of its tabs. I will plan to use those binders throughout my chiropractic career and to complete them by continuing to further my education, even throughout my practice, with seminars and research and all of my day-to-day patient orientations and things that I come by. I would like to keep them in this binders. Let's start off by talking a little bit how I'd like to conduct my new patient experience. I'd like to invite my patients to a new patient orientation. I would like it to be a group setting, and I'd like to let them know that they're allowed to bring whoever they would like to bring to this orientation and call it a night of learning. I'd like to inform them about what chiropractic actually is, and I would like to see what they knew about chiropractic before coming into a chiropractic office. I'd like to get a little bit of their feel for chiropractic before I go and tell them exactly what chiropractic is and how it would serve them and for the rest of their lives. I would start off by introducing chiropractic after asking all of their questions and answering all of their questions of what chiropractic is to them. And then I'd actually let them know what it is, but in very simple form, something that they can take with them and continue to spread, so that they can spread the word of chiropractic and in a whole. So the orientation would start off by what chiropractic is, and then further move on to the brain-body connection, how you can specify certain adjustments for certain things. For example, headaches, migraines, pain, neurological symptoms, stomach upsets, and how the body truly heals itself, and how everything that happens within our body can be helped through this one big thing called chiropractic. And I'd like for them to go on and spread this word to other people. So I want them to be so intrigued and so engulfed in this thing, because to them it would be so new, for most of them, that they would be excited to go and tell people, because now they know how. So I want to make it that simple for them, so that they can go out and spread the word and bring their whole family. I want them to know and understand chiropractic as well as we do, which is why we want our entire family to go and seek care, because this is one of the few things that can help you with almost anything in your body. So like I said, chiropractic helps the body heal itself. So I want them to understand that to not really the molecular or scientific level, but a very simple way. I want to be able to ask children in my orientation simple questions, and for them to be able to answer them. Something as easy as, what happens when you have a cut? How does your cut heal? Is that the Neosporin that you're putting on your body? Is it, mom's cooking, whatever it is that they want to, I want them to understand to the point where it's the body, the inside of their body, that is making all these changes to rapidly fix the problem and the issue. So I want it to be that easy, so that a 6-year-old could even understand. And then after my patient orientation, that would be the goal, to make them want to go out and continue spreading the word, and for them to really realize, like, wow, this is what I need. This is what I've been looking for, and this is what everybody should use and should need. And then after that, I'd take them one by one and then answer their personal questions in their room, and if these are patients that have already come in to see me, that were referred by somebody or by insurance company, I would then obviously at this point go over their report of findings. So I would have asked them to come to my night of learning or my patient orientation after we've already gone through their first examination. So that would be for most of them. And then for some of them, this would have been their first time ever even stepping foot into the office. So this would be an invitation to them for them to come and get their first examination. Now, after that goes on, it moves on to my chiropractic assistant. So I want the learning to continue even throughout the process of them getting switched, the role getting switched to my chiropractic assistant being one-on-one with them. I want them to continue to teach them things about chiropractic, continue to answer their questions, so they have to be knowledgeable as well. And during the report of findings, I want to be able to have my patient understand what exactly is going on in their body. I want to break it down to them and answer any questions that I can, and have them understand why it is that they need to be coming in to see me. Or maybe that's when I would tell them why they need to seek other care if that was the case. I would like the learning experience to continue throughout their entire time in my office, and the patient orientation is just a glimpse of what will continue to be shown to them as far as education on chiropractic and the brain-body connection and how all that works throughout their entire life. And then it's just a glimpse of what they will be getting when they come into the office. Now, I would follow up with all of that by continuously asking them questions about how they can relate to chiropractic, or just having things in the office that are fun for their knowledge, as far as chiropractic goes and the nervous system goes. And I want them to be so knowledgeable that they continue to seek other people to come and get chiropractic. They have the urge to tell people to come in. And I want to be able to have a relationship with my patients so that I can tell them to come with me to some seminars. So it goes down all the way down to that, so that they can continue seeking knowledge far beyond my ability. So that's where I would like to leave this video off, by stating that the patient is always going to be continuously learning just as much as I am, which is why I have these binders, once again, to continue my knowledge and to continue going back and seeing where I was and where I am now. And that's it. Thank you.